Lower back pain. Experts estimate that nearly 85% of Americans will suffer from it at some point. Though pain in the lower back or lumbar region occurs for many reasons, one of the most common causes is a herniated disc.
The low back, otherwise known as the lumbar spine, is a crucial part of your back because it's a lower structure that helps support us when we're sitting and standing throughout the day.
The disc is sandwiched in between two vertebrae. The disc is the absorbs impact when you jump up and down, and it allows you to move, to rotate.
And the reason why it's so important to have the disc in between the lumbar spine is that when a disc degenerates, it can degenerate enough where there's less space available for the nerves. So not only do you get back pain, you also can get nerve pain, which goes down into the legs. That can create a lot of problems because you can have leg pain that can lead to weakness and inability to do your daily activities.
Ruptured or herniated discs can be the result of overuse, injury, or aging.
Disc degeneration certainly can be caused by genetics, a large portion of that, but it can also be caused by environmental factors. We found that vibration can create disc degeneration because of the constant loading and unloading of the disc can create an environment where the disc degenerates more easily. Even traumatic injuries where falls from height or jumping off of a ski jump, those can create disc degeneration also. And even something trivial or small, such as a small slip that may cause initially a herniation or a disc bulge, can create a disc that's more susceptible to injury down the road.
If there's an injury to the disc, it doesn't heal. So injuries are permanent and accumulate.
Treatment options vary depending on the severity of the tear in the disc. According to doctors, about 80% of cases can be treated by conservative or non-operative therapies. However, for those patients who require surgery, there is an advanced new procedure called transforaminal lumbar interbody fusion, or TLIF.
And it's a gobbledygook mouthful, which really means that you're doing a fusion of both the front of the spine and the back of the spine through a very small incision in the center of the spine. What it does is it allows the two vertebral bodies, which are moving painfully together, to become one piece of bone, so it eliminates the pain.
Because transforaminal lumbar interbody fusions are minimally invasive, they may present less risk to patients, and studies show that TLIF procedures have the highest fusion success rate.
3 years ago, I was able to run, and as we came into 2 years, I was only able to walk, and then as we came into the last year, I wasn't able to do any exercise, be physical, ski, or even enjoy some of the normal things that I like to do in life.
This procedure that we call the TLIF is a procedure that heals remarkably well and very quickly. Normally within 4 to 6 months, you have an absolute solid fusion, and you can go out and play golf. You can go back and bungee jump and rollerblade and pole vault and do all those other wonderful things you want to do.
My recovery has taken about 6 months, 4 to 6 months. After 2 months, so you feel really strong, almost feel like a normal person again, and it only gets better from that point forward.
The success rate for a TLIF for back pain is on the order of about 90% for 2/3 relief of pain. So patients who get this procedure are normally quite happy once the fusion becomes solid.
Before undergoing TLIF or any spinal surgery, experts stress the need for a thorough diagnostic evaluation and advise back pain sufferers to consult a spinal specialist.
We always try to stress to patients we need to find where the pain's coming from, because if you don't know where the pain's coming from, you can't treat it. And I think the most significant way to do that is selective injections, diagnostic tests such as an MRI or even a CT scan, and certainly even a good therapy session can be helpful.
Back pain had pretty much cut out all my activities, and I had maxed out on pain pills and seen a physical therapist, had tried acupuncture, tried steroid shots, and I still was at the point where I had pain most of the time.
If lower back pain is keeping you from enjoying an active lifestyle, let the experts at the Steadman Hawkins Clinic help stop your suffering.
At the point where my pain overtook my life, I consulted my physician about what were my choices. He suggested Steadman Hawkins.
The Steadman Hawkins Clinic provides thorough diagnostic services, and their highly experienced team of physicians will find the right treatment option for you.
We have a very comprehensive range of services that we offer at Steadman Hawkins that includes non-operative care, injections, therapy, aquatics, even surgical care for the people who need that.
My fusion surgery resulted in the fact that I have no pain whatsoever anymore. And the promise of going back to an extremely active life.
Specializing in orthopedics and sports medicine, the goal of the Steadman Hawkins Clinic is to help each client reach optimum recovery by providing the highest level of care and personal attention.
The clinic is very accessible, was very easy to get to, and of course they're world renowned for their successes orthopedically.
My experience here was exceptional. My hospital care, the surgeon's care, the PA's care, everything was exceptional.
For unparalleled expertise and commitment to care, choose the Steadman Hawkins Clinic. To learn more, visit SteadmanHawkins.com.